morning, good afternoon, good evening po sa lahat. Saan man pong panig ng daigdig kayo naroon. Welcome to our 101st 101 episode po of the Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being a part of our credible online community. And to all those who have just discovered us for today, welcome po. At sana po masiyahan po kayo sa ating mga topic, not just for today but for our future webinar topics. The COVID-19 lockdown, it has created a baby boom of sorts as hundreds of thousands were unable to access birth control and, they stayed at home. And it is estimated that an additional 214,000 unplanned babies were born during the pandemic. So, nadagdagan po ang annually ng 1.7 million births a year dahil po rito. Ang worrisome pong information doon po sa statistic na yon is that between 40,000 to 60,000 births po ay among minors. So with so many women po exposed to COVID-19 habang sila po ay buntis, habang sila po ay nagpapasuso ng kanilang mga anak, yung information po about kung paano po ang best to stay safe and protect both mothers and babies, kailangan po yun, lalo na po sa mga bata po ng mga ina na unprepared, kumbaga po, sa kanilang pagbubuntis. So, ang mga katanungan po natin for today, should pregnant women be vaccinated? If a pregnant mom gets COVID, should she still be vaccinated? Ligtas po ba na magpa-breastfeed kung meron po kayong COVID? Is it safe for a lactating mom, yung po nagpapasuso na ina, to receive COVID vaccination? So, gaya na po sa ating title ng webinar, ang pagpapasuso sa panahon ng pandemya. Yan po ang ating topic for today's webinar. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday. And I always look forward to Fridays because I get to share hosting duties with our adjunct research faculty, also the President's Special Envoy for Global Health Initiatives, Dr. Susie Pineda-Mercado. Dr. Susie?
Hi, Raymond. Good afternoon. Magandang hapon po sa inyong lahat. Saan man kayo naroon. And I notice there are many watching from outside of the Philippines, very interested in breastfeeding. We'd like to welcome you. We have excellent speakers for today. And I'd like to just greet some people who are always with us. Mary Jane Ong, Josephine Pueda, Criselda Balansay, Maria Aurora Ortiz, Sinag De Leon Amado. Marami pang mga iba, no? So, kamusta po kayong lahat? Welcome to all of you, and nice to see the familiar names coming out on the chat before we start. And we've got a really interesting topic today. But just to say that we have, as you saw in the opening billboard, we rewrote a little bit what COVID meant, so that we're not just talking about COVID, but we're talking about, of course, we're monitoring COVID. We're looking at other outbreaks. We're also looking at viruses, infections, and disasters. So join us today. I hope you will learn a lot. We are expecting to learn a lot because we really have great speakers today. We bring you the best from Stop COVID Deaths. And Raymond, balita ko baka mamaya medyo may French leave ka. Ganun ba?
Meron po akong personal update, Dr. Susie. Recognition po kasi ng aking anak in the middle of the broadcast.
Wow,
I will be dropping off.
congratulations!
Thank you
Kaya
po.
pala blooming and beaming. Ano bang gagawin ng anak mo sa sa ceremony nila?
We cannot afford to be late kasi siya po ang magkukumpas ng lupang hinirang. So we cannot start without
talent? Galing ba sa iyo yan? May musical talent ka rin?
I would like to believe so. So yung
dapat naman sa audience yan. Diba? Sige. So we won't have Raymond for the whole program, but we will have Raymond who's going to sit in for you.
Yeah, so as in previous webinars po, no, we'll have Assistant Vice President of UP System, Rica Abad, who will be joining Dr. Susie during the rest of the show po. So thank you so much, AVP Rica.
Okay, so thank you very much. Well, many of you really want to get the latest updates on health and medicine here in the Philippines and abroad. And because of that, we have created a special section called the News Update. Okay, so in our news, the regional Epidemiology and Surveillance Unit reported recently that Cebu City topped Central Visayas localities with the most number of dengue patients, having 708 cases and 11 deaths from January to May of 2022. This figure is more than 9 times higher as compared to the same period last year, 2021, where they only had 80 cases. So the efforts are now underway to prepare for more cases, but of course, prevention is most important. According to their city health officer, they are working on cleaning the environment, cleaning of the schools and infrastructure that may be breeding sites because of stagnant fresh water, and conducting an information drive for parents and for children. So that's happening in Cebu right now. So we've got COVID, but we're also seeing some cases of dengue. Raymond, over to you.
Thank you, Dr. Susie. Very important po, lalo po sa ating mga viewers from the Visayas, to take note of that really rapid increase in the cases of dengue. But just to shift back to one of the more global po na mga issues po, lalo po sa patungkol sa multi-country na outbreak po ng monkeypox. I'm sure narinig nyo na rin po ito sa mga news outlets. As of May 25th, which is 2 days ago po, no, a total of 219 confirmed cases na po sa buong mundo ang nagkakaroon po ng monkeypox. Karamihan po dito ay nadedetect sa mga young men, those who self-identify as men who have sex with men. Ang mga kaso pong ito ay matatagpuan sa 12 na member states ng World Health Organization. Sa Estados Unidos na lang po, ang meron po silang na-identify na 9 na monkeypox cases sa 7 states by the Centers for Disease Control. So ito yung po isa sa mga babantayan po natin. We're a bit fortunate dahil hindi pa po siya nakakapasok po ng ating borders, and the DOH really strengthening the border strategy, and we hope that something that will not add anymore to our pandemic situation. Over to you, Dr. Susie.
Yeah, Raymond, I remember when we started, we were just looking at one case in Massachusetts. Remember when we started talking about it? Parang there was only one case, and I think about 20 cases around the world, no? But now we're looking at so many, and I think what you're trying to say is that they are looking at the possibility of it being sexually transmitted.
Sexual transmission, yes.
Right, okay. So we will keep you updated and posted on the news every Friday with our news update. Over to you, TVUP. Okay, so we're back, and back to our webinar. We're going to talk about breastfeeding. Breastfeeding rates in the Philippines have not really improved over the years. It's stagnated at about 29%. And recently, Raymond was talking about a shortage in infant formula. Mother's milk is still the best, no? And yet, we see that breastfeeding rates have not been going up. And even during this time, during the pandemic, where you would expect maybe that there would be more attention given to the infants by breastfeeding mothers, parang kulang, no? So we're going to talk about how important this is and what kind of advice doctors and nurses. We have a lot of doctors in the audience and nurses. I saw some new names of people who are joining us, no? Very, very important what kind of advice we give, because those first few months of life, where the mother can provide the best nutrition, could be missed if we do not encourage women to breastfeed. So we're going to talk about that, and as we mentioned, we've got the best speakers for you. So I think we have persons on the street. Raymond, go ahead.
Yes, thank you, Dr. Susie. Especially for those who are joining us for the very first time, we usually start off our discussion just putting it into context by taking the pulse of the common folks on the street po. Ang katanungan na itinanong po namin sa kanila, kung ang isang ina ay may COVID-19, ano po sa tingin ninyo ang mangyayari kung siya ay magpapasuso sa kanyang sanggol? At bakit po ninyo ito nasabi? Watch this.
Ko, kapag ang isang nanay ay may COVID-19, ay positive sa COVID, tapos siya ay magpapasuso, sa tingin ko, ano naman siya, safe wala naman siyang magiging problema para dun sa baby.
Isa ito sa pinakamahalagang na tanong ko sa aking OB at sa Pedia when I was about to give birth in December and January. So kung maaalala nyo, nagkaroon ng biglang escalation ng cases back in January. Naging positive kami ng partner ko for COVID, and our primary issue was how I could give birth kasi parang due na ako in a month or in a few weeks, and how I can breastfeed. Wala naman daw itong relation or studies na nagpapakita na may negative impact or may negative effect ito sa bata.
Kung may COVID yung ina, tapos magpapadede sa kanyang sanggol, siguro naman hindi makahawa yung anak niya. Kasi nga airborne yung mode of transmission. Hindi naman siguro dahil sa mismong breast milk ng ina.
So, ang magkakaroon lang talaga siya ng effect kung hindi tama or safe yung breast milk or breastfeed sa mga babies nila. So, dapat talaga mag-wash ng hands and then before and after magpa-breastfeed.
Generally, safe naman magpatuloy ng pagpapasuso kahit positive yung nanay. Pero, ayun, hindi na siya yung talagang breastfeeding na direct. Siguro mas safe kung magpa-pump na lang muna yung mother, then isa-sanitize, isa-sterilize yung lalagyan ng milk, then yung tsaka siya papainumin sa baby.
Siguro, dapat lang may face mask ng nanay para ligtas yung sanggol niya.
When I gave birth, hindi ako agad nakapag-produce ng milk, and nagpanic ako. And what caused the delay of my breast milk was my stress. So, hindi totoo na may impact ang COVID or kahit ano pang sakit. It matters a lot in terms of what you intake as a parent. Always refer to your doctor at sa LGU.
Maging vigilant lang tayo.
Talagang doble, tripleng ingat. As much as possible, limit yung paglabas pa rin, and limit yung pakikihalubilo sa maraming tao.
Dapat meron tayong vaccination. Nakaka-affect din yun sa bata kasi bawal pa silang mag-vaccine at an infant stage. So ikaw ang magti-take nun para sa kanya.
Thank you very much, TVUP, for that. It's always great to have a sense of what ordinary people think about what we're talking about. Person on the street, no? So mukhang maraming understanding about breastfeeding, but still a little bit, some parts were still not that clear. So we're going to hear from experts about this and about vaccination of women who are pregnant and lactating. But before we do that, I think Raymond wants to talk about the certificates of attendance.
Thank you, Dr. Susie, and thank you, TVUP. For all those who are asking, certificates of attendance po will be given to those who have watched at least 50% of the webinar duration. So we have already sent out for our 99 webinars po, no? All of the certificates. Meron pa pong pakonte-konte for webinar number 100 na isi-send out po namin. We also have received few, I think it's a handful lang po na mga emails asking for information with regards to their webinar certificates. That's 99 and below. So yun po yung mga tinitignan po namin sa aming records din po. For today's webinar, we will be using po and following the standard panel discussion format. After our speakers have presented, it will be followed by a Q&A session wherein we will be entertaining questions coming in dito po sa Zoom, or sa Facebook po, or sa YouTube. So if you have any questions po that you are hankering to ask, please put them in the Q&A box dito po sa Zoom or sa comment section po ng Facebook and ng YouTube. Dr. Susie?
Okay, so I think we are going to start with our fun quiz. Fun quiz na tayo.
Oh, okay, yes. Thank you,
Go.
Dr. Susie. Meron na po. Can we have on the screen yung pong sa Slido natin, lalo na po yung mga para sa ating mga Facebook and YouTube viewers. Okay.
Hello.
Kumusta na kayong lahat?
Hi, I'm Doc Susie, the mini Doc Susie.
And I'm Doc Radar, the mini Doc Raymond. Are you ready to have fun? Simply open your browser to www.slido.com and enter your code to participate. We will discuss your answers during the panel discussion later on in the program.
We will have it flashing on your screen in a bit, and we look forward to your answers. Masaya at madali lang ito. Join na!
Thank you so much, TVUP. Can we also have the Slido on the... There we go. So, dun po sa mga nasa Facebook, lalo po sa Facebook or sa YouTube, if you could open your internet browsers and type in slido.com, and then when you're prompted, you enter the code 5405717. That's 5405717 for you to be able to participate in our 2-question survey. For our first question, ano po ba ang mga bakunang ligtas para sa mga buntis? Is it hepatitis B vaccine? Is it influenza vaccine? Is it COVID-19 vaccine? Or lahat po ba ng nabanggit ay ligtas? We'd like to greet those who are joining us from the Cagayan Valley Medical Center in Tuguegarao, from the Jose B. Lingad Memorial Regional Hospital, specifically the Human Milk Bank that's there in San Fernando, Pampanga, mga kabalen, San Sebastian District Hospital in Sablayan Occidental, Mindoro, Federico Roman Tirador Senior Memorial District Hospital in Iloilo, the Metro Davao Medical and Research Center. For our question number 2, thank you. Gaano katagal pwedeng ilagay sa refrigerator? I repeat, gaano katagal pwedeng ilagay sa refrigerator ang breast milk na nakolekta ng isang ina? Ito po ba ay 3 buwan, 2 linggo lang, o 1 hanggang 8 araw lamang, or 24 oras lang po ba ito naglalas? So, please type in your answers po, no? We are seeing medyo kalat-kalat po, but this is a very, very interesting question, and we hope you'll remember the correct answer at by the end of this webinar. We'd also like to greet those who are joining us internationally from Canton City, Vietnam, the University of Hail in Saudi Arabia, as well as the Qasim University in Buraida, Saudi Arabia, and those from Dammam, Lunichi Ali University of Blida II in Algeria, those from Stockton, California. Good morning, I think. The UPPGH Alumni Edmonton, Alberta, Canada, and the St. Eustatius Auxiliary Home Foundation in the Netherlands, Antilles. So we'll not be closing this survey po muna, no? So, and we hope to be able to get more of you to answer our fun quiz for today. And then we'll move on to our webinar proper. Dr. Susie?
Yeah, thank you very much, Raymond. Okay, let's go to our webinar proper. And our speaker today is not new to you. Isa po siya sa mga paborito nyo na nagbibigay ng closing remarks. Kasi pinipili namin nagko-closing remarks, yung mga magagaling mag-summarize. Kami kasi ni Raymond, hindi namin yung power, di ba? Pero yung mga iba, magaling sila. So anyway, Assistant Director for Operations of the Philippine General Hospital. She's an integral part of our program. Kung hindi po sa kanya, hindi natin makukuha lahat ng mga dalubhasa ng PGH, no? Na naiimbita niya, natatawagan niya para makapunta sila rito. Pero ngayon naman, ibibigay natin sa kanya ang floor. We will give her a chance to speak. She's an obstetrician gynecologist and a very avid supporter, advocate for breastfeeding, chair of the Philippine General Hospital Breastfeeding Committee. Let's welcome Dr. Stella Marie Legaspi Jose. Stel, welcome. Ibang role ka naman ngayon. Welcome, Stella.
Good afternoon. Thank you, Susie, for that kind introduction.
Sige, go ahead.
I'm happy to be here. Actually, nagpresenta ako eh. I
Tama
volunteered
naman yun.
myself.
Tama naman yun.
Okay, thank you very much. So, the title of my talk is Pregnancy, Breastfeeding, and COVID-19. Next slide, please. So, this is my disclaimer. I am not connected with any pharmaceutical company, and I am not endorsing any product. Next, please. So, this is the outline of my lecture to discuss the maternal and neonatal outcomes of pregnant mothers with COVID-19, to discuss vaccination for pregnant mothers, and to emphasize the best breastfeeding practice during this pandemic. Next, please. So I would like to quote this article by Drs. Clemente Amosco, Octavio Bravo, and Dr. Tita Villanueva, who published recently in 2021 at the Acta Filipina Journal. So the maternal and neonatal outcomes of pregnant women with clinically confirmed COVID-19 admitted at the Philippine General Hospital. Next, please. So it is an ambidextrous cross-sectional study. So when we say ambidextrous, it is a combination of retrospective and prospective data. We had 209 obstetric patients with proven COVID-19 infection admitted at the Philippine General Hospital from April to August 2020. 14 pregnant mothers consented to specimen collection for testing of vertical transmission. Next, please. And so this is the result of that study. Majority of pregnant women with COVID-19 had a good outcome. Labor, delivery, and the immediate postpartum periods were uneventful. Now, all-cause morbidity rate is high at 75.6 per 100 cases, including one case of Guillain-Barré syndrome. So this one, I have to explain this a bit because PGH is a tertiary center and we really get morbid or toxic patients. So that's why the morbidity rate is high. But the in-hospital all-cause mortality is 1.19 per 100 cases. Now, the causes of maternal death are acute respiratory failure, septic shock, and in one patient, there was congenital heart disease, atrial septal defect with Eisenmenger. This was presented in the early part of the pandemic, here also in TVUP. Next, please. So the conclusion of this study, so we must remember the study was done at the early part of the pandemic. The prognosis for COVID-19 infected patients was generally good and most were discharged. Almost all the neonates born to COVID-19 infected mothers were stable term infants. And in this study, there was no evidence of vertical transmission. So let us remember that. So the virus is not present in the breast milk. That's why the mothers can really breastfeed. Next, please. So this is the pie graph of that statement. So from March 2020 to January 2021, there were 2,000. This is from the national survey of the Philippine Infectious Disease Society in OBGYN. And thank you for our president, Dr. C.D. Bravo, who initiated this, one of those who initiated this review. No? So there were 2,674 patients. And if you see the pie graph, most of them, or 62%, were asymptomatic, 27% were mild, and 4% moderate. And the severe was only 4%, and critical was 3%. Next slide, please. And then Delta came along, the Delta surge came along, and the numbers really changed. If you look at the pie graph, the severe from 3% rose up to 5%, or 87 patients have severe disease. And critical was 68%, and 68, the number was 68. Before, it used to be 14 only. So you see there was a rapid, there's a change in the numbers when the variant came along. Next slide, please. So this is the monthly breakdown. And if you look at it, August and September, the numbers were really high. So the severe from 7% became 30 patients. And the August, and then the September, it was 24. No? So the numbers really rose when the variant came along. Next, please. So this is the COVID-19 related mortality. So initially we had 17, then later on it became 85 in 2021, January to November, giving a total of 102 patients. So 102 pregnant women died during this time, okay, from March 2020 to November 2021. Now, what is the profile of these patients? Next slide, please. So, the age of gestation, most of them, or 48, delivered more than 28 weeks. Okay, but still, 28 weeks, the survival of babies born at this young age of gestation is not so good. It's not good. No? Next slide, please. The manner of delivery. 59% underwent cesarean section or abdominal delivery. 14% vaginal and undelivered were 27%. So let me explain this a bit. Uh, the dictum for obstetricians is to do a cesarean section for obstetric indication. So what is an obstetric indication? For example, dystocia or a contracted pelvis, or the patient had abruptio or uh, placenta previa, that you really have to do a cesarean section. But if you look at the numbers, the percentage is quite high because during the pandemic, if the mother goes into a very long course of labor, the chances of infection of the healthcare workers is high because the mother and the healthcare workers will stay in the same room, in the same labor room or delivery room. That's why in some hospitals, no, if labor will exceed 8 hours, the tendency of the obstetrician is to deliver by cesarean section to protect also the healthcare workers. Remember, the nurses go on shifts, and in one shift, in a private patient, they will have to pay for the PPE of all those nurses, and then another group of nurses will come in, for example, the afternoon shift or the evening shift, and again, the patient will have to pay for the additional PPE. So the it's not really a policy, but what was followed was if the course of labor will be long, then an abdominal delivery was done by the obstetrician. Next, please. So the fetal outcome, 61% had live birth, but look at the fetal death in utero. It is quite high. It is 39%, or 30 babies died, no, in utero because of the infection, because of COVID-19. Next, please. So in this table, we analyze the vaccination status of the patients. And you see that uh, zero maternal death for the fully vaccinated. That's why I volunteered actually to lecture on this, because I want to impart to all of us that vaccination is really one of the key or the key points to save our mothers, no, to prevent maternal death. Now, two patients died, just received one dose, and the unvaccinated was majority at 75. 75 women died. Those who are unvaccinated, and 8 were unknown. Next, please. And so we go to this question: is COVID-19 vaccination recommended for pregnant women? Yes, next please. And the answer is yes. COVID-19 vaccination is recommended for pregnant women, and there is no evidence of adverse maternal or fetal effects from vaccinating pregnant individuals with the COVID-19 vaccine. So this is the POGS practice bulletin. POGS stands for the Philippine Obstetrical Gynecological Society, and they release a practice bulletin for everyone, for all the OBs. Okay, next, please. So, is it safe to administer the COVID-19 vaccine during pregnancy? So, that is always asked of us. Next slide, please. So, in this table, I want to show the risk and benefit of vaccination. So the benefit, so we see that COVID-19 infection is more severe in pregnancy because the pregnant woman is immunocompromised already. So just the pregnancy alone gives us that point of view. And the risk here, so we give the vaccine because the benefit outweighs the risk, no, the risk of dying. Okay? So the COVID-19 vaccines are not yet tested among pregnant and lactating women. So later on, there were studies testing it already, and it was still proven safe. Now, studies have shown very high efficacy rate for COVID-19 vaccination. Okay, so as you have heard in other previous webinars, when we say efficacy rate, that is the studies in the laboratory. Okay, so the efficacy rate is high. Now, the risk there is you can have side effects and injection site pain or redness, fatigue, headache, fever, and muscle pain. But the side effects are minor compared to the benefit of vaccination. COVID-19 infection is not acquired through vaccination. It is acquired by aerosol, by coughing or the coughing, sneezing in a closed room, and the aerosol or the droplet infection goes to another person. It is not through vaccination. And the risk there, but these side effects, or the side effects mentioned earlier, does not affect pregnancy. Okay, so in the study in the US, among 35,000 women, they said that the benefit really outweighs the risk. Okay, so less than 14% risk of miscarriage, and no congenital anomalies seen. Only mild reactions were seen. So, next slide, please. And so, in this practice bulletin, it was well expounded that the risk of COVID-19 in pregnancy is real. It can happen, especially because of the immunocompromised state of the woman. The benefits of vaccination outweighs the risk because of the current limitation of safety data in pregnant women. And COVID-19 vaccine does not cause COVID-19 disease. Next, please. So the Department of Health has made this statement that pregnancy is not a contraindication to getting the COVID-19 vaccine. If a pregnant woman is a part of a group recommended for vaccination, it can be offered. So what group of women are these? These are the healthcare workers who are every day in contact with a COVID-19 patient. So they are at highest risk. So the nurses, the med techs, and all those healthcare workers. So it is advised to get the vaccine after the first trimester of pregnancy. So the DOH is just being careful because after the first trimester, organogenesis was already completed. So the chance of having congenital anomalies is low, okay, if ever, because there are still no reports of congenital anomalies from the vaccine. Next, please. This is an ACOG conversation guide for clinicians, so the American College of OBGYN. So what should you tell your patients? So the talking points with your patients are, first, the risk of COVID-19 infection during pregnancy. Okay, so we have to explain that because of the immunocompromised state, you can have a severe or critical illness. No? So for one, we had a fellow here in PGH who had severe COVID-19 infection. Good that she survived the pregnancy and also the baby. Now we want to emphasize the safety of the COVID-19 vaccines and the efficacy of the vaccines. Now for the newborn, the safety and efficacy for the newborn, because the IgG antibodies are passed on to the newborn after maternal vaccination in the third trimester. So the antibodies from the vaccine, but there is also the IgA antibodies which comes out through the breast milk. Okay? So those two antibodies will help the newborn. Now we have for those who are not vaccinated or who do not want to be vaccinated, we have to continue our support for them. So it can be reminding them about frequent hand washing, physical distancing, and mask wearing. And again, reinforce vaccination in the next prenatal checkup. Next, please. So, what are the breastfeeding practices during the pandemic? So, I would just like to put this into context that this is what happened at the early onset of the pandemic. Okay, so at the start of the COVID-19 pandemic, there was little knowledge of the role of breastfeeding in the transmission of the COVID-19 virus. So even here in PGH, the mother and baby were separated at birth. So this was at the start of the pandemic. And then the mother pumps the breast and gives the express breast milk to the nurse who does cup feeding in the nursery. Now, let me warn you about the use of the breast pump. It is not really recommended, no? So because I saw in the person on the street that she said that the mother will pump the milk and then transfer it to a bottle and give it to the baby. So we do not advise that, no? Because we do not advise that because the baby will have nipple confusion. Nipple confusion is when the baby prefers the bottle over the mother's breast because the baby will have a hard time sucking, and so the baby will always prefer the bottle. And so because of decreased breastfeeding, gradually the breast milk of the mother will decrease and it will eventually dry up. Okay, so if you notice here in this slide, here in PGH, when we separated the mother and the baby, the nurse does cup feeding, not transferring it to a bottle because of that reason. Next, please. So the WHO gave out a recommendation. WHO said that data is insufficient to conclude vertical transmission of COVID-19 through breastfeeding. So the virus does not come out of the milk, does not come out with the milk. No? The virus, the baby can get infected if the mother does not wear a mask. Okay? So in infants, the risk of COVID-19 is low and infection is typically mild or asymptomatic. It is encouraged that breastfeeding mothers with COVID-19 strictly follow the healthcare protocols, the use of a face mask and hand washing to avoid transmission to the baby. And as I mentioned earlier, secretory IgA has been detected in the breast milk of mothers with previous COVID-19 infection. So that is the good news there. So WHO made this very strong policy statement. Next, please. So the WHO said that mother and infant should be enabled to remain together with rooming in throughout the day and night, to practice skin-to-skin contact, including kangaroo mother care, especially immediately after birth and during the establishment of breastfeeding, whether they or their infants have suspected or confirmed COVID-19. So it's very important that the mother and the baby are always together so that there will be skin to skin contact. And the establishment of breastfeeding is not instant, no? It is an effort. It is, how do you call this? It is developed, no? The baby has to learn how to suck at the breast of the mom. And the mom, especially the new mom, must learn how to breastfeed the baby. There are many positions to breastfeeding, and my partner, Dr. LIBADIA, will expound on that later on. Next, please. So, slide on EINC, which is Essential Intrapartum Newborn Care. What we call the Unang Yakap, I would like to acknowledge Dr. Mian Silvestre, who really proposed this. She was the one who started it. Unang Yakap, abroad they call it the first embrace. Okay, so the first step is immediate thorough and drying of the baby so that the baby will not have hypothermia. Then early skin-to-skin contact. So if you look at the picture, the mother, just after she gives birth, she's still being sutured, no? Her episiotomy is still being sutured. The baby is already on top of her. Okay, so there's early skin-to-skin contact within 1 hour from birth, and that really helps in the promotion of breastfeeding. Properly timed cord clamping. So after the pulsation of the cord has stopped, that is when you cut the cord. You clamp the cord and cut the cord because just by delaying the cord clamping, there is increase of blood volume to the baby as much as 72 ml. So that is the blood transferred to the baby. And again, the non-separation of the newborn from the mother for early breastfeeding. Next slide, please. And this is, you will hear this often in the talk of Dr. LIBADIA. This is the kangaroo mother care. So we give this for low birth. We do this for low birth weight infants and for those premature babies. And the baby is at the mother's breast the whole time. And she wears a tube blouse and the baby is there. So it is like a human incubator. And that is the beauty of it. There are many studies on kangaroo mother care. You know, I started reviewing the articles 2003, the earliest by Dr. Ray and Martinez in Colombia. And they noted an increase in the survival rate up to 70%. Another study in Ecuador by Dr. Sloan. And this is a randomized controlled study. And the babies who did kangaroo mother care, 5% had severe disease as compared to the control 18%. So that is involved 700 babies. And so 300 for the KMC, 350 patients in the KMC group and 350 in the control group. And they stopped the study. They terminated it because it was very obvious that kangaroo mother care has a very big advantage for them. Next slide, please. So this is the next slide is my last slide. Mark Yan. So I just want to show this to you. This is a picture of my patient. You know, the patient, the babies, they were twins, no? But the first of twin, so she delivered at 29 weeks. Okay, 28 and 5 to be exact. 28 and 5 weeks. And so both babies were in breech presentation. Since I know that preterm breeches that small, 551 pounds, grams, no? The survival is very low. So I did a partial breech extraction on both twins, no? And the first of twin had congenital diaphragmatic hernia and passed away, succumbed before 24 hours of life. Now this baby, the second of twin, which weighed 551 grams. So the mother did kangaroo mother care. And the baby and the mother stayed in PGH for 5 months. Imagine, 5 months until the baby was well enough to be discharged. Okay, so this is, I think she's the only one who I don't know without, maybe I'm wrong, but one of the very rare babies that we had who reached, who survived, no, that small weight. So that's the last of my slide. And thank you very much for watching. I hope you learned something about breastfeeding, lactation, pregnancy, lactation, and the COVID-19. Thank you.
Okay, thank you very much, Stella. That was an excellent presentation. I think we take many things for granted when we're thinking about pregnant women and newborn infants, no? And so, especially this last story that you gave us, no, was really very touching and inspirational, just to show you that a very simple thing that we could do, kangaroo care, right, could save a life, and many other things that you talked about, no, unang yakap and all of that. So I'm sure you can see all the hearts coming out and the clapping hands. So really an excellent presentation, very clear and very well articulated. Thank you so much, Stel. And I'm sure people have some questions. Actually, I saw some questions already on the own team.
Ayun, may pala tayong clap hand audio.
Sige. Okay, Raymond's going to introduce our next speaker. Raymond, go ahead.
Thank you, Dr. Susie, and thank you for that interesting and informative lecture, Deputy Director Jose. We look forward to the Q&A session, wherein we hope to be able to answer questions coming in from the Zoom or in the comment section po ng Facebook or YouTube. Next up, it's our pleasure to introduce ito pong ating next speaker. If we had the OBGYN perspective. Ito naman po will be from the pediatric perspective naman po. She practices pediatric neonatology and is the head of the PGH Human Milk Bank and serves as the co-chair of the PGH Breastfeeding Committee. She is also clinical associate professor with the Department of Pediatrics at the UP Philippine General Hospital. Please welcome to your screens Dr. AURORA GLORIA LIBADIA. Dr. Au?
Magandang hapon. Ako po ay nagagalak to discuss ang pagpapasuso sa panahon ng pandemya.
Oh, wait. Oops. I think we lost Raymond. I think we lost Doc Au. Doc Au, we
No,
can't
she's
hear
here. She's here, I think. Okay, go ahead, Dr. Au.
There you go.
This is my disclosure statement. I have no conflict of interest to declare. These are my objectives: to present the under 5 mortality, neonatal mortality, the preterm birth breastfeeding rate in the country, to discuss the importance of breastfeeding and the risk of not breastfeeding and its impact on the economy, to explain the milk chain, the path towards successful exclusive breastfeeding, and to present the relevance of human milk banking. The under 5 mortality rate in the country was 26.4 deaths per 1,000 live births, newborn mortality rate at 12.6 per 1,000 live births. Here in this graph, what you see is a very slow decline of neonatal mortality rate since 2008. And to be able to reduce the under 5 death o pagkamatay bago mag 5th birthday, we need to look at and address the causes of neonatal death. Philippines ranks 8th for the number of babies born prematurely before the 37 weeks age of gestation. The preterm birth rate is 13 per 100 live births, and the preterm birth complications is the #1 leading cause of neonatal death. So when do newborns actually die? This graph shows that 3 out of 4 newborns die in the first week of life, particularly the first 2 days of life. The existing perinatal conditions predispose these newborns to an increased risk of dying immediately after birth. These are the relevant strategies to prevent neonatal death. The early essential newborn care, or the Unang Yakap protocol, averts more than 70% of causes of neonatal death. The evidence is solid. These are the following newborn care practices that would save the lives of newborns and the mothers as well. And the kangaroo mother care, supporting a universal access to high quality care of practices for preterm and our small newborns. This graph shows the risks of infection-related death because of diarrhea, pneumonia, sepsis, correlated with the time of initiation of breastfeeding in hours, which is the 4th step of the Unang Yakap protocol. The initiation of breastfeeding should be performed within 60 minutes of life. However, if this is done within the 24 hours of life, what you see here, the risk of infection-related death would be doubled. And if the initiation is performed when the mother is ready for discharge, here what you see, there is 4-fold increase of the risk of infection-related death. The optimal infant feeding, breastfeeding within the first hour of birth, breastfeeding exclusively for 6 completed months, from about 6 months of age, add adequate complementary food, and continue exclusive breastfeeding up to 2 years or beyond. So this is what breastfeeding is all about. This is the healthiest start in life. Both mother and child. The #1 intervention to prevent child death, full of love, full of antibodies, preventing infection-related death due to diarrhea, pneumonia, sepsis, prevents all forms of malnutrition, including obesity, increases intelligence scores, prevents not only communicable diseases, but non-communicable diseases as well, prevents severe uterine bleeding, prevents breast cancer and ovarian cancer, postpartum depression, easier for the mother to get back to pre-pregnancy weight. It's also a form of contraceptive. It also protects the environment, more savings for the family and the nation as well. However, even these benefits are known, the global breastfeeding rate have increased very little in the past 2 decades, while sales of formula milk have been doubled in roughly same date. And in our country, the exclusive breastfeeding rate remains low at 34%, and the early initiation of breastfeeding is only 57%. So each one of us and every family should understand the 21 dangers of infant formula that the infant formula companies don't want you to know. For the child, it increases the incidence of communicable diseases, infection, non-communicable diseases, malnutrition, including obesity, sudden infant death syndrome, and for the mother, it increases the incidence of hypertension, diabetes, cancer, and may become pregnant sooner. More than half of parents or pregnant women exposed to aggressive formula milk marketing, particularly this COVID-19 pandemic. Unethical marketing strategies used by formula milk industry uses $55 billion to influence parents' infant feeding decisions. So what can we do now? Globally, only 41% are exclusively breastfed, and suboptimal breastfeeding contributes to more than 800,000 infant deaths and countries' loss of more than $300 million US. The World Health Assembly has set a target to increase exclusive breastfeeding to at least 50% by 2025 for the first 6 months. The following are the recommended actions. Limit formula marketing, strengthen the monitoring enforcement legislation related to the International Code of Marketing of Breast Milk Substitutes, support paid maternity leave, empower women to exclusively breastfeed for 0 to 6 months, strengthen the health system, expand and institutionalize the Mother-Baby Friend Initiative in all health systems, support mothers with community-based strategy to support exclusive breastfeeding counseling for pregnant and lactating women, peer-to-peer and group counseling and communication campaign. And if we would be able to improve the rates of breastfeeding, this would lead to better health and well-being of a child and a mother. And this also improve physical and school performance, productivity, stable jobs, higher income, improve the economy of the country as well. We could be able to save more than 16 million in health system treatment costs related to reduced mortality and morbidity, generates $3.8 billion for the economy through increasing children's cognitive capacity and preventing premature deaths, further reduce families' out-of-pocket healthcare expenditures, and divert $839 million families spend on breast milk substitutes every year to basic needs, including healthcare and food. So this is the milk chain, the path towards exclusive breastfeeding, antenatal education, skin to skin at birth, breastfeed within the first hour, mother and baby together, show how to breastfeed. Do not give supplements, breastfeed on demand. Do not limit the duration of feeding. Empty one breast before offering the second breast. Express if mother and baby are separated. So the mother should be emotionally, psychologically, physically ready before giving birth, receiving adequate support and right information. And in the birth plan should include the EINC or the unang yakap, breastfeeding, kangaroo care, and rooming in. Skin-to-skin contact, which is the second step of the EINC, and kangaroo care for our preterm and small newborns. We also have the Republic Act 7600 rooming in as a national policy to encourage and support breastfeeding. And the mother should also understand that the newborn stomach capacity on the first day of life is just like a small calamansi. They just need 5 to 7 milk per feed. Akala nila kulang o walang lumalabas. And they should also be sensitive on the feeding cues. These are the early and mid signs that the babies are already hungry. Early cues, tearing and the facial expression, opening of the mouth, turning of head. Mid cues, the movement of arms and legs, and bringing the hand to the mouth. And when they recognize these cues, bring the baby to the breast and wait for that wide open mouth. It's a no-no to wait for the late cues. Crying, it's a late sign of hunger. And these cues mean call me first, then feed me. Breastfeeding position for successful breastfeeding. What you see is the chest to chest or tummy to tummy, in line, close, supported, and facing. There should be no distance in between their chest. Good attachment. We don't want this poor attachment. Paano malaman kung poor attachment? May masakit po ba habang nagbe-breastfeed? Chin away from the breast, mouth not wide open like a fish mouth. Lower lip pointing forward or areola more visible below than above or in equal amounts. Ayaw natin ng poor attachment because this result in sore nipple, engorgement. Baby's unsatisfied, iyak ng iyak, ayaw tumigil, feels frustrated, refuses to suckle, and baby fails to gain weight. Please teach all the breastfeeding position, particularly the cross cradle and the underarm. Dito, there will be better attachment. The mother could be able to visualize that wide open mouth. And the baby could be able to latch on most of the areola na chest and nipple. Nipple, butas lang. Areola, pag areola, tamang hakap, maraming milk ang matatransfer sa baby. Happy si baby, happy si mommy. And some tips, dapat happy, positive thoughts, walang nega sa breastfeeding. And positive support and environment. Positive support from all the people around her. Her partner, the doctor, the nurses, the midwife, the community, the mother support group. Takes a village to raise a child. Correct breastfeeding positioning and attachment. And this for our newborns with cleft lip and palate, complete or incomplete, breastfeeding twins, position, and even our triplets. So please promote breastfeeding. Do not break the code. No promotion of breast milk substitutes, breast milk supplements, feeding bottles, teats, pacifiers in health facility. We as health workers should not request nor accept from formula companies and their representatives gifts of any sort, sample or products covered under the code of marketing of breast milk substitutes, not only milk, but any product that would promote their company. Posters or other promotion materials, sponsorship without permission from interagency committee approval headed by the Department of Health, endorsement of products covered by the milk code. Ang boss sa breastfeeding is the baby. Breastfeeding is a baby-led feeding. Watch her baby, not her watch. Hindi pwedeng bumalik ka every 3 hours sa NICU to breastfeed your child. Kung hindi siya gutom, do the skin-to-skin contact or the kangaroo care. Sensitive on feeding cues. Empty one breast before offering the second breast. And if they are separated, if the baby is admitted to the NICU, we need to establish the production of milk by doing hand expression using a syringe. Then every 2 to 3 hours to sustain the production of milk. And for those mothers with inverted or flat nipples, very effective is the syringe method. Cut this end and then place the plunger on the cut end. And for those who are separated, also the mothers are already working, they need to know how to collect and store their breast milk at room temperature, 4 to 8 hours, if placed in the refrigerator with this 2 to 4 degrees centigrade 1 to 8 days. And it can be placed in the freezer, wherein the compartment is just one compartment of a refrigerator, that is 2 weeks. If two-door refrigerator, in the freezer, that is 3 months. If deep freezer, 6 to 12 months. And if it's already thawed in a refrigerator for 24 hours. And also, this is the legislation to protect breastfeeding employees, the provision of lactation period for breastfeeding employees in addition to meal times, at least a total of 40 minutes for every 8-hour work period. And setting August every year as a breastfeeding awareness month and encouraging health institutions to put up human milk banks. So to be able to sustain the milk production, even the mother is working, please advise them to empty their breast every 2 to 3 hours to sustain the lactation. And cup feeding with Mommy and Sylvester here. This is a safe alternative to bottle feeding using the express breast milk. It wouldn't result in nipple confusion and associated with better breastfeeding success. And this, we have so many lactation, or the mother support group in the country. They are also our heroes. And they provide free counseling online. There were the mothers before who had problems about breastfeeding, and now they are the ones who are helping them. And providing this breastfeeding guide, or Gabay sa Breastfeeding, Mahal Kong Ina breastfeeding guide, and let them watch breastfeeding videos and provide them NICU hotline numbers if they have breastfeeding concerns. So the natural calamities regularly befall the Philippines. Our country was affected by calamities from volcanic eruption, typhoons, fire, the COVID-19 pandemic. During disasters, the best emergency preparedness is a confident, well mother, capable of nourishing her child. The best emergency response is one that works with her to protect and support her confidence and capacity. Breastfeeding provides the most secured food supply, the cleanest, the safest form of infant nutrition. Particularly this COVID-19 pandemic, revisit your policy and be guided by the position statement developed by the Philippine Society of Newborn Medicine, endorsed by the Department of Health, Philippine Pediatrics Society, and the Philippine Obstetrical and Gynecological Society. The non-separation of stable mother-infant diet, the unang yakap, kangaroo mother care, breastfeeding, rooming in regardless of maternal COVID status, with strict implementation of infection prevention control measures. Breast milk is not just a food, it is a complex fluid rich in nutrients and bioactive components that cannot be replicated by any artificial formula. Infants with no access to their own mother's milk, donor milk is life-saving, the best alternative feeding option. In 2009, the Philippine General Hospital Human Milk Bank was formally launched under the leadership of Dr. Maria Asuncion Silvestre and the late Dr. Pura Flor Isleta. True to its advocacy of responding to the call of those in need, our milk bank has been active, providing aid during national emergencies. So what is Human Milk Bank? It is a service established for the purpose of screening, collecting, processing, storing, and distributing pasteurized donor milk to meet the specific needs of preterm and sick babies for whom it is prescribed. A breast milk donor who is healthy, willing to undergo verbal and written screening and submit to physical examination and serological testing, HIV, Hep B, and congenital syphilis. These are the infants with great need of safe and nutritious nourishment. Human Milk Bank also help the mothers to fill the gap during disasters like typhoons and COVID-19 pandemic. The ideal nutrition for critically ill and premature infants in the NICU and preventing necrotizing enterocolitis. Pasteurized pasteurization process using the Holder method. Heating 62.5 degrees for 30 minutes and rapid cooling destroys the bacteria and viruses, including HIV and COVID-19 virus. And during disasters, milk drive was also initiated and overwhelming from different LGUs and NGOs, including the mother support groups. And the Milk Matters, the flagship project of the Phi Lambda Delta sorority of the UP College of Medicine, that have helped to have adequate supply of breast milk. During early pandemic, we continued still the training to ensure the safety and quality of our breast milk and distribution of pasteurized donor milk to those in need in other hospitals. So this is the overview of the human milk banking system. Milk from screen donors placed in home freezer, transport to the hospital, placed to our milk bank freezer, thawing, pulling of the milk, pasteurization, bacteriological culture before and after pasteurization, placed again in milk bank freezer, gentle thawing, and then if negative for any for bacterial culture, this is given to our babies. So the human milk bank shall serve as a temporary solution to provide neonates and infants with no access to their mother's breast milk, accessible only with physician's prescription. So this are currently, we have 27 human milk bank in the country. There are also other hospitals in the region trying to establish their milk banks. Please contact this number. So breastfeeding and human milk are the normative standard for infant feeding and nutrition. Breastfeeding is not just a food, it's for nourishing and immunoprotection. Given the short and long-term medical and neurodevelopmental benefits of breastfeeding, infant nutrition should be considered a public health issue, not just a lifestyle choice. Breastfeeding isn't just about milk, it's all about love. And it's wonderful to have someone who understands breastfeeding and can support them in their efforts. So I would like to end this talk by showing you this video.
What you are about to witness is a video illustrating the step-by-step essential newborn care protocol developed by the Department of Health. This protocol adopts international evidence-based standards set by the World Health Organization. They directly address the Millennium Development Goal of reducing child mortality. The Philippines is among 42 countries that accounts for 90% of deaths among children below 5 years of age globally. Studies have shown that 70% of newborn deaths may be averted during labor, delivery, and immediately postpartum. In short, it is in the first few seconds and minutes of life that every newborn Filipino is given the chance to survive and to have a better life. During those first few moments, in the arms of a mother, during the first embrace, sa unang yakap.
That ends my lecture. Thank you for your kind attention.
Yeah, thank you very much, Dr. Au. Ang ganda naman ng presentation mo. Ano naman, ang mga hearts, ang mga clapping mo, but such a nice presentation, I think. Always reminding us how important it is to breastfeed, but also showing how milk banking has advanced so much in the country, no? Talagang, yun lang parang kulang pa, no? I think you were saying 27, no? But my goodness, we have so many mothers. Of course, the milk banking is supportive during, you mentioned disasters also for women who are working. But it's so nice to see the setup and all the progress that has been done. So very well appreciated presentation. Maraming salamat, Dr. Au. So at this point in time, I like to introduce our new co-host. Hindi naman yung host.
Hello. Hi, hello everyone. I'm just pitching in for Doc Raymond. So thank you very much, Doc Al, for sharing with us your knowledge and expertise on protecting, promoting, and supporting breastfeeding in the Philippine setting. And also thank you, Doc Stella. Wonderful, wonderful presentations from both of you.
Okay. So, si Rika, familiar na kayo sa kanya, no? So, she's going to help us move along. We're now going to our panel discussion. We're going to ask Stella and Doc Au to open their cameras, their videos. But, and while they're doing that, Rika's going to introduce our public service announcement.
Yeah, so before we go into our Q&A session, let's just take a quick break for a special public service announcement today.
Ay, ate, gusto ko nang lumabas at makipaglaro.
Eh di ba magkakasakit daw tayo kapag lumabas?
Magpi-face mask naman ako eh.
Kahit na, hanggat wala daw tayong injection, hindi tayo pwedeng lumabas at maglaro.
Ano ba yan? Takot pa naman ako sa injection.
Huwag ka mag-alala. Parang kagat lang daw ng langgam yun.
Talaga? Eh natatakot pa rin ako.
Eh di sabay na lang tayo.
Pa-injection?
Oo, syempre. Loves kita eh. Para makapaglaro na tayo.
Dahil mahal ko kayo, magpapabakuna ako.
Kaya mga bata, magpabakuna na kayo.
Stay safe and stay well. Mga bata, magpasama na sa Bakuna Center.
Wow, cute. Thank you very much, TVUP, and also especially our Stop COVID team, no? Because the COVID communication PSA is one of the many creative outputs of the Stop COVID Deaths team to push for pediatric vaccination for children aged 5 to 18 years old. And Doc Susie, no, we hope that they can share ito message natin on the PSAs. They're available in the TVUP YouTube channel as a playlist, so you can share it with everyone. And yes, please, magpasama na kayo sa Bakuna Center.
Okay, so we will not stop promoting vaccination kasi yun talaga importante. Hindi pa naman po tapos ito, hindi pa tapos, marami pang hindi nababakunahan. So we're just very grateful for TVUP for producing all these interesting materials, and as Rika said, share natin yan, no? Okay, so let's get the ball rolling. I think I saw some questions earlier on the Q&A, but I think Stella may have answered them, but let me start by asking both of you, because you've both been very intimately engaged with mothers who are breastfeeding, no? Sa tingin niyo ba, what is the most difficult question given to the frontliner about a mom who can't breastfeed? Ano yung pinakamahirap na sinasabi nila na parang pag sinabi nila yon, nahihirapan kayong sumagot? Nako, hirap ng tanong ko, no? Parang what is the most difficult question that you've encountered? I'll start with Stella. Stella, ikaw muna.
One of the most difficult really is yung the mother feels that her breast milk is not enough. If they have this misconception na parang that breast milk will just come out of their breast without any effort from the mother or the baby. It's not like that at all. It is a learned behavior. You have to learn how to breastfeed, and the baby has to learn to suck from the mother's breast. So, convincing them otherwise, that's the difficult part, because you will what Al said, no, I will tell my patient the stomach of the baby is just like a small calamansi, and then it gets filled up at once and then gets emptied at once also. So, you just have to be persistent in explaining. That's how I do it. Pero there is always that resistance there. So they're going to work, they're going to go back to work. So I will tell them, that's still far away, 105 days. Maternity leave is 105 days. You have a lot of time to breastfeed, and then he'll teach you what to do when you return to work. What do you think?
Stel, sino naman yung mga nag-uudyok na, na wag na, bigyan nyo na lang ng bote yan.
Yan, that's the mother-in-law.
Mother-in-law, oh my goodness. Oh, mother-in-law ba? Totoo?
Yan, that's the problem. And then the the poor girl, the poor postpartum woman, syempre she doesn't want to offend her mother-in-law. So, okay, so that's one of the, in a study
Also,
that came out, no? That came out.
so,
Mother-in-law has a lot of
okay.
influence.
So yun pala ang kailangan nating kausapin. Di ba? Yun ang
Both of
kailangan
them.
kausapin ng frontliner na pwede ba wag na kayong makialam? Okay. Ikaw naman, ano yung pinakamahirap na reason or question na naharap mo from a parent, from a mother?
Doc Susie, pwedeng like a condition or situation.
Yeah,
For
sure.
me, ang mahirap is yun, pag wala ding support system. Kasi to have a successful breastfeeding, it should be a wonderful and beautiful. Dapat teamwork yan, hindi pwedeng mother lang. So, pag walang support like from the partner or yung sabi ni Ma'am Stella na the lola or the mother-in-law, for example, mahirap. Pero pag nag-counsel, ideally nandun sila. Or minsan, pag magsasalita pa lang ako, konti pa lang sabihin, hindi doc, wala wala talaga, gusto ko na mag-formula yung father. Papasok na ako. Sabihin ko, madaling mag-formula, madali ding magkasakit. So, very important din is the follow-up kasi lumalabas yung sore nipple, usually the third day. No? So kung walang magsusupport o pangit yung attachment, hindi niya alam. Talagang nakakalungkot yun. Another situation, pag dumating na, meron ng mastitis or beginning abscess, it's really very painful. Talagang sobrang tiyaga and baw sa mga maming ganun. Pero pag nagkakagano na, talagang parang talagang special sila and the follow-up would be like every other day, or at least the communication is open, or with the technology, kahit malayo, you can see them, the positioning and attachment, usually doon nagkakamali. And since I started the cross-cradle and underarm, konti na lang yung mga poor attachment na pagbukas ng bibig, natutulak ng mommy yung ulo para mahakab yung areola, para maraming lipat. So akala kasi the cross-cradle for the preterm or small baby, pero effective siya kahit term. And very crucial yung mga umpisa talaga kasi pag malaki na sila, diba kahit anong position, okay na. So they do the cross cradle or the underarm. Siguro, the patient would tell me, the mom, 3 weeks lang. Cross cradle, then cradle naman ulit para sigurado lang perfect yung attachment. And the positive support, positive thoughts. Kasi kung what they think kulang, yun yung mangyayari. The oxytocin reflex would not work, di ba? You laugh, you sing, you talk to your baby for the oxytocin to work and correct positioning and attachment. And dapat wala talagang halo to make it successful. Kung very impatient na sila, yun na, pwede na magka-feeding talaga kung naunahan ng iyak. Pero otherwise, kung direct, yun yung mga tips na pwede natin ibigay. So the household chores, dapat sa tatay na yun. Di sa
Tama.
Agree
ako doon. And I think the important thing you said is that the counseling has to involve the family. No, parang minsan yung nanay, syempre kakapanganak lang, 'di ba? Pagod din 'yan no. Tapos pag nauudyukan, very easy to give up. I have one more question I'm going to turn over to Rika because Rika might want to ask some questions too. So in your view, ako, I breastfed both my kids completely. And for my daughter, it was about 9 months. And for my son, it was actually 2.5 years. Na walang formula, no? And tama yung sinasabi nyo na basta't marunong na silang mag-feed, kahit nakabaliktad pa yan, kahit ano pang posisyon yan, no, kayang-kaya nilang mag-feed. So kailangan talaga tiyagaan, tsaka yung tawag nito, yung persistence. Diba? Yung parang hindi ka talaga susuko in the beginning. But I think going back to what you said, Stella, actually, one of the misconceptions is that it's easy. It's not easy. It's difficult. It's difficult. But then, it's also very fulfilling and very satisfying. Okay, so let me ask you the second question. No? So we want the moms to breastfeed at least for 6 months, completely walang halo. Kasi yung iba, ang sabi nila, halo, wala namang, hindi, it doesn't harm, no? Pero actually, it does. Kasi, iba yung nipple, iba yung bote, yung nipple, yung chupon, di ba? So, let me ask both Stella and Au. So in your experience, what makes them stop too soon? Kasi maganda sana yung 6 months completely, no? Pero bakit sila, yung iba, magpapadede ng konti, tapos okay na. Parang, nagpadede na ako, ganyan. Sige, ano bang mga reasons nakikita nyo kung bakit nagsa-stop too soon?
Yes, usually it's a work. Let's face it, no? Now, if the woman contributes a lot to the family economy, the economic situation, so usually both of them are working. And when the woman goes back to work, that's where the challenge is. You have to convince the moms to still continue breastfeeding. That when they are at work, they will pump their breast and store it properly in sterile bottles and put it in the refrigerator in their office. So that's why there's a law that there should be in all offices there will be a breastfeeding room, no? Depending on the number of employees, I cannot remember if, for example, there are 1,000 employees, how many rooms they should have. There's a law like that. So here in PGH, we have the creche. Okay, so the nurses, the doctors, the residents who are breastfeeding, they go there to pump their breast. So I hope also in other government institutions, government hospitals, that they have that. No? And that really helps a lot. Even if the mom is working, she can still continue breastfeeding. I would like to answer again the first question, no, add to my answer. Ang isa pang challenge is breastfeeding twins. Yan talaga mahirap. Kasi when you feed one and then when the first one is done, the second one is hungry. And then by the time you finish feeding the second, the first one is hungry again. So yan, that's another challenge. Yan, addition to my answer.
Hindi pwede sabay, Hindi pwede sabay yung dalawa. Yeah. Thank you, Stella. Dr. Au, what about you? What do you think is the most common reason for not persisting, for ending too soon?
Yeah, the marketing, very strong. The companies, they spend billions of dollars to change or influence the practice, the feeding, kahit purely breastfeed, tas to narinig or minsan during disaster nag-iiba, no? And the support system, kung wala, may mga patients kami, wala talagang support. Parang minsan ikaw lang, or so it really matters kung may support system. Kung wala, kunyari wala siyang matanungan or hindi niya alam yung correct positioning, ang daming mother support group na free sila, sobrang very supportive and coaching kung hindi nila ma-reach yung doktor nila o yung nurse nila o yung midwife, no? And also, yun nga yung sabi ni Ma'am, yung work, kasi marami rin hindi nila alam na they could store breast milk, and the 105 days maternity leave hindi din for all. So yung iba din na nag-work, wala silang mga ganyan, they need to work, mga ganun. So I think kailangan yung support system, the message, the information, minsan it matters din when we counsel, the voice of the person talking, kung paano natin sila kina-counsel, na minsan daming patient, parang nagmamadali, pero ito talagang extra, you need to be compassionate and understand them. Nasabi nga ni Doc Susie, hindi siya madali, no? But it would just be difficult. It's just temporary. Hindi siya forever mahirap. Kasi actually, masarap siya. Ang daming savings. Actually, kung marirealize mo, ang daming mong naipon kasi hindi siya madaling magkasakit o ma-hospital and bumili ng gamot. So, mga ganun yung na-feel ko.
I think, Stella, go ahead. Stella, you wanted to say something?
Yes. I was just going to say that in the 10 steps to breastfeeding, number 10 is community support. Yan. So what I was saying in creche, there's a hotline that you can call it so that if you have problems with breastfeeding, somebody will really answer to you. I will just ask. I can't remember exactly the hotline, but I'll most probably you know that. That anytime you need help, there will be somebody who will answer you. There's a support is a very important part of breastfeeding. You cannot do it alone, definitely. You have to have family support and community support. It's good that my husband, oh yeah, he's listening. Ato was very supportive. And so it was a successful breastfeeding voyage for me also. All my 4 kids were breastfed. Yun.
Yeah, you know what?
Doc Susie,
Yeah.
tama yung important talaga yung support. Kasi it's not just you, sabi niyo, it's not easy. It's also very tiring, di ba?
Yeah.
To breastfeed. Kasi mas mabilis nagugutom yung bata, di ba? Parang every 4 hours you have to breastfeed. So, Doc Susie, madami nag-agree dito sa ating mga chat, no? Like to thank you nga yung UP Manila Crash, Doc Stella, for mentioning them. Si Shelo is from UP Manila Crash. And we also have some comments here. Si Merlin, sabi niya, I'm happy to say that my younger sister successfully breastfed until today, no? Niece niya is first child and will be 3 years old na this September. O, di ba? Tagang
Congratulations. We are at the rare. Yung ganyang katagal, very rare na yan.
Oo. And then we also have our regular. Our regular
Oh.
si Tinag Aurora de Leon Amado. Sabi niya masaya daw siya na nakapagpasuso siya ng mga anak niya at hindi gumamit o bumili ng formula milk kahit kailan. Yan. Congratulations. Yan. Meron dito question na Doc Susie from Minnie. Sabi niya, how can we help new parents who have symptoms of postpartum depression and at the same time is a struggling breastfeeding mom?
Okay, nice. Good question. Sige.
Stel,
and
since it's an OB question, it's really postpartum depression is a transient occurrence, no? So it usually happens immediately after birth, and the way to manage this is really family support. You reassure the mom that she's okay, that everything went well, and she has nothing to worry about. Do not worry about cooking and all the household stuff. It's more of supporting the mom. Now, by definition, for example, it extended more than 1 month, it can be clinical depression already. So we can refer the mom to a psychologist or a psychiatrist for further counseling. But usually, postpartum depression, it's quite transient, no? And once the mother feels the baby, she's always with the baby, gradually that postpartum depression will go away by itself kasi she's very happy looking at the baby. Kahit kamukha ni mommy o kamukha ni daddy, happy yan. It's a happy occasion. And then you're looking forward to the baptism naman. So, Filipinos, we are a family-oriented race. So postpartum depression, it's just talking it out with the mom. Yeah.
Rika, what else do you have there?
Pero dito, what is the clinical treatment for a mother with both COVID and mastitis?
Wow.
First of all, if the mother is COVID, we have to, in the HTAC, yung health technology, it's the group of against COVID, no? Health professional against COVID, so HPAC. There is an algorithm there for pregnant women with COVID. So for asymptomatic, for moderate, for severe critical. And if we follow the algorithm, the moderate, severe critical, they are admitted in the hospital. So they should be hospitalized. Okay. Now about mastitis. So mastitis is it's an infection of the breast tissues, usually because of improper latching on of the baby. So when the baby's mouth is attached at the areola, when the baby falls asleep, you do not just pull out the baby's mouth because this causes abrasion in the nipple area, and the bacteria in the mouth of the baby will enter that one, that abrasion, that microabrasion, and it will lead to mastitis. And so for mastitis, we give oral antibiotics for the mother. And so if it, like a few days, 7 days is already enough and it will resolve by itself. Now, unlike breast abscess, when you have to do surgical intervention, you have to drain the abscess. No? So now the mother with mastitis, it has to be treated. That's all. But she can still continue breastfeeding. Let me emphasize that. Mother with mastitis, so you breastfeed on the contralateral side, on the other side that is not infected. You breastfeed there first, and then that's when you put the baby on the side with mastitis. The bacteria doesn't enter the the what do you call this? The the bacteria doesn't enter and get into the milk, unlike breast abscess. In patients with breast abscess, the milk is already contaminated with bacteria. So you do not breastfeed in patients with breast abscess. You pump the milk, you pump the breast and throw out the milk. But in mastitis, you can still continue breastfeeding.
Oh, yun pala. So yun pala dapat magandang advice yun, ano? Pag mastitis, you can continue to breastfeed. Yeah, nice. You have anything else there, Rika?
May mga tanong dito, pero I think masasagot siya ng Slido, question. So maybe it's time to show our Slido.
Go for the Slido, Rika. Go.
Let's go, let's show them how our viewers have answered our Slido and our Zoom poll for our fun quiz earlier. Okay, so can we have the Slido on screen as well? All right, so ano ang mga bakunang ligtas para sa mga buntis? For our Zoom, no? Sa Zoom poll natin, ang pinakamalami, all of the above, ang sagot. Well, the same also, 82% sa Zoom and 80% sa ating Slido ang nagsabing all.
That is correct, all of the above. So you can receive the COVID-19 vaccine, the influenza vaccine, and the hepatitis B vaccine. So giving the hepatitis B vaccine, it can be she already had hepatitis before hepatitis B, and this is what we call post-exposure prophylaxis. Okay? Because the hepatitis B virus can pass through the placental barrier and infect the baby. So we give also hepatitis B during pregnancy. It is safe to be given during pregnancy. So the answer there is all of the above.
Wow, okay. Thank you, Doc Stella. Now for our second question, gaano katagal pwedeng ilagay sa refrigerator ang breast milk na nakolekta ng isang ina? Sa Zoom poll natin, ang pinakamadami, 31% ay 3 months. Sa ating Slido, 46%, 3 months. Ano pa yung sagot dito, Dr. Au?
Nako, nahirapan yata sila. Pero kailangan po nating tandaan ito. Yung tama po, ituturo ko kasi para pag nag-counsel po tayo, most of our patients po, they would work. So pag tandaan natin, pag yung freezer po, yung refrigerator, 2 pintuan, so separate yung doors. Sa freezer ay 3 months. No, pag isang pintuan lang yung labas ng refrigerator, sa freezer po ay 2 linggo. So 3 months, tapos 2 weeks sa freezer pag 1 door yung compartment sa labas. And then kung sa refrigerator, ito po yung sa baba, 1 to 8 days. And kung wala pong refrigerator, ilalagay lang po sa cooler na may frozen gel pack or ice or dun sa jar na may tubig, malamig po ito. Pwede din po yun 24 hours. So ang tamang sagot po ay 1 to 8 days o 1 o 8 araw. Pag, for example, minsan po, pag nagka-counsel tayo, ni Ref, wala sila ni Kutsara, wala. Ang pwede po nilang gawin, lalo na yung early pandemic na walang transportation, napunta sa isang quarantine facility, walang refrigerator, kailangan kasing ma-empty yung breast every 2 to 3 hours para hindi mawala. So it's either inumin niya po ito, no? Kailangan ma-empty talaga. So pag hindi kasi, kunyari, gawin niya lang 3 times a day or more than 3 hours, her body would secrete feedback inhibitor of lactation, and that would stop the milk supply. So ganun din po pag may milk bank, hindi po dapat nakaasa sa milk bank. Kailangan we empower these women. Let them feel they are part of the team. Continue kangaroo care. Kailangan sila mag-empty ng milk sa breast every 2 to 3 hours para hindi po mawala. And for thawing, from freezer to the ref. No, magdamagan hanggang ma-thaw. O kung nagmamadali, ibabad sa tap water o maligamgam, never na hot, or wag po i-boil or i-microwave. That would kill the immune cells, no? And yun po. Tapos hiwalay sa meat and fish when they store breast milk. And pag nasa work, may cooler sila, may frozen gel pack. So meron kami taga-bangko, no, na teller siya, naka-cover, nag-express daw siya habang nag-work. And also we have fellow
Naghang yata si. Ayan.
We encourage that and we love that. Thank you po.
Wow.
Okay.
Yeah,
Yeah,
so
thank
we
you.
have some comments here ang nakakatuwa naman, no? Si Annelie, sabi niya yung baby daw niya, 4 years old, breastfeed pa rin daw niya. And she's so happy. Wow. And
Yeah.
also, si Jose
Congratulations.
Jr., no? Gochoco Jr. sabi niya, yung wife daw niya, wow, pinagmamalaki niya yung wife niya. You breastfed my youngest son up to age 6. Hirap daw sila sa mall at hindi na kasya sa breastfeeding station kasi malaki na.
Ang cute naman.
Oo. Nakakatuwa
Pero
naman.
congratulations to all the fathers who are supportive.
Yeah.
You know, I was gonna share something with you. I don't know if you have watched yung sa Netflix na The Midwives, yung called The Midwife. Anyway, it just occurs to me kasi na dati, ang nagtuturo sa atin mag-breastfeed is our mother, right? You don't need a doctor, a nurse, or whatever kasi the mom will help the daughter breastfeed. Pero dun sa movie na The Midwives in the late 50s and the early 60s, talagang yung mga milk company became very, very aggressive. And they really made it parang fashionable na may bote. Diba? So there's an entire generation of women who really believe, kasi sabi nga ni Stella, yung mother-in-law, diba? Meron talagang isang generation ng mga kababaihan na natamaan nung marketing na yun eh. Kaya sa kanila parang tsaka sinabing hindi na maganda yung breast nyo after, hindi na kayo sexy. That whole time of the late 50s up to the 60s, no, they did not breastfeed. So the children, their daughters, didn't have anyone to go to. No, so I think we really want to kasi the best way really to learn is I have helped a couple of my friends breastfeed kasi yung mga nanay nila hindi marunong magturo sa kanila. So I think we should, if we know how to breastfeed, we should teach others, help them breastfead kasi it takes some amount of effort, but it really needs, what should I say, yung sabi nga ni Awe, yung compassion, no, yung the love, yung tone, hindi yung ganito ganito, hindi ganoon eh. Parang di ba? Yeah. Parang it has to be done in a very, very loving way. So kudos to all the guys out there who are supportive of breastfeeding. Dapat yata may mga may mga medalya kayo. No, kasi it's a journey of the family, right? It's not just the mom and the baby, it's also dad too and the rest of the kids. Okay, I think we are coming close to the end of our malapit na naman tayong matapos. We will give our speakers a few minutes to think about their parting words. Meanwhile, Rika is going to walk us through our evaluation for today. Rika, go ahead.
Yes, so if you see on your screen for our participants in Zoom, we have the evaluation poll, the panel discussion evaluation poll. And 5 questions lang po ito, no? Panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. Panelists spoke clearly and audibly. The panelists used appropriate language with technical and medical jargons adequately explained, and the panelists contributed to new perspectives and knowledge on managing various key health issues. So please just continue keying in your answers while Doc Susie will ask our panel to give their parting words to our viewers.
Okay, so we're keeping it open for you. I know many of you always like to be part of the evaluation. Okay, we'll start with Dr. Au LIBADIA. Au, what are your parting words to our frontliners who are watching us now?
We think of breastfeeding. This is the healthiest start in life, the foundation of life, the first food security system, and the rights of every mother and a child. So 2 out of 3, they don't receive adequate support. So kailangan nila ng support para sa pamilya at saka ekonomiya ng bansa. Salamat po.
Thank you very much. That's Dr. Au LIBADIA, who is head of the Milk Bank of the Philippine General Hospital. Okay, let's go to our main speaker, Dr. Stella Jose. Go ahead, Stella.
So, I would just like to emphasize the role of vaccination. We want to protect our pregnant mothers. People some died because of lack of vaccination. So I showed the figures already, and that is so heartbreaking. Sometimes the mother and the baby they both died. And there were instances like that. So please convince your patients to be vaccinated. It is safe. It can be given after 14 weeks age of gestation. Second is I am a breastfeeding advocate. This has been my life's work. I am the breastfeeding chair since 1996. So I did not leave my position because I like the work there, and I think I influence a lot of people to breastfeed also. So breastfeeding my children was one of the best decisions I made in my life, and I do not regret any moment of it. It has been a very loving journey for me, and all my children are all achievers. So what we are saying in intellectual development, neuropsychological development, the emotional EQ. Okay, so it's very good, no? And I have personally seen it in my children. So thank you very much for listening to us. Thank you.
Wow. Well, thank you very much, Stella. Together ng ating episode today. Thank you everyone for a very lively Q&A session. We are now sharing the panel evaluation poll results. And as always, our viewers have given very high and rave reviews for all our speakers. Thank you very much for showing your appreciation to our guest speakers who have made time in their very hectic schedules to be with us today. And now to formally close this webinar, we will hear a brief synthesis and closing remarks from the Chancellor of the University of the Philippines, Manila. Please welcome back to the webinar, Dr. CARMENCITA D. PADILLA.
Magandang hapon po sa inyong lahat. Today we learned that the COVID pandemic has led to a baby boom because families were not able to avail of birth control methods during the past 2 years. And we had an additional 214,000 unplanned pregnancies, with about 40 to 60,000 with parents who were minors. So in today's webinar, we now turn to the value of breastfeeding and the best practices to ensure safety to mother and baby during the pandemic times. The first speaker is Dr. Stella Jose, and here are the highlights from Dr. Stella, who shared PGH data. First, among the mothers who agreed testing after delivery, it showed that there was no vertical transmission. In the second set of data, Dr. Stella showed that majority of the pregnant women with COVID-19 had good outcomes. Labor, delivery, and immediately postpartum were uneventful. Prognosis for COVID-19 infection was generally good. The next data presented observations on 2,674 PGH patients, wherein majority were asymptomatic. And yes, with the Delta surge, there was an increase in severe and critical cases, about 3 to 5%. Now, there were some COVID-19 related mortality, and in the past 2 years in PGH, there were 102 who died. Now, Dr. Stella said that there was an increase in the cesarean deliveries, and she shared that this is coming from the perspective of protection of the health workers, especially for cases where mother had prolonged labor of more than 8 hours. bringing increased exposure of all the health professionals in the labor room and the delivery room. The PGH data showed that there were zero deaths among the fully vaccinated. So COVID-19 vaccination is definitely recommended for pregnant women. There is no evidence for adverse maternal or fetal effects from vaccinating the pregnant woman. And the advice is to get the vaccine after the first trimester. There was a lengthy discussion on the benefits outweighing the risk. There was also a recommended conversation with the mother. So I want you to watch the replay and review what Dr. Stella shared with us. Now let us turn to COVID times. At the beginning of COVID-19 pandemic, the mom and child were separated. But this has changed because data is insufficient to conclude vertical transmission of COVID-19 through breastfeeding. It is recommended that they stay together with public health protocols. Our second speaker is a pediatrician neonatologist, Dr. Au. And Dr. Au said that in the Philippines, the under 5 mortality rate is 26.4 per 1,000 births. The preterms are 13 per 100, and 3 to 4 babies die within the first week of life. So we've got to come up with strategies to make sure that we attend to this most vulnerable set of our population. A few must from Dr. Au. At birth, immediate drying, early skin to skin, properly timed cord clamping. And this time, Dr. Au shared all the benefits of breastfeeding. She had a long list of merits of breast milk, the best to avoid infections, combat malnutrition, full of antibodies, savings for the family. And now I urge you to watch the replay and review her long list of merits for breastfeeding and breast milk. Now, unfortunately, in the Philippines, breastfeeding is low at 34%. We need to do better than this. Dr. Au presented the 21 dangers of infant formula. So what can we do as a community? Collectively, there must be a limit to formula marketing. Second, we have to support paid maternity leave. Third, strengthen health systems through community-based strategy to support or counsel or for counseling for exclusive breastfeeding. And even in the Q&A, they mentioned again and again the role of the community. Dr. Au reminds us, breastfeeding is baby-led, demand feeding. And she gave us cues for feeding the feeding cues of a hungry baby. And you've got to watch your replay and take a look at all the cues so that you know that the baby is hungry. Towards the end of her talk, she talked about the milk chain, highlighting the role of the antenatal education and the preparation of the mother to be psychologically and emotionally ready for breastfeeding. Now to the issues on storage. She answered this, but let me repeat it again. Okay, at room air, 4 to 8 hours. If refrigerated, 1 to 8 days. Take note for freezing, it depends on the type of the freezer. Freezer with 1 door, 2 weeks. Freezer with 2 doors, 3 months. Deep freezer, 6 to 12 months. And if thawed in the refrigerator, 24 hours. And I think, this is a message wherein extra milk will never be wasted so long as you know how to store the breast milk. Now, the importance of the milk bank has been explained by Dr. Au, and we need this in every health facility to ensure that we are able to provide a temporary solution to provide neonates and infants less than 6 months of age for those with no access to the mother's breast milk, milk accessible to the patients because of prescription. So in other words, there comes a time when there's really no milk from the mother and we need the milk bank. But this is not an end all. She said that we must empower the mothers to breastfeed. The milk bank is not the end. The milk bank is just filling a gap. So remember that the breastfeeding and human milk are the normative standards for infant feeding and nutrition. And breastfeeding is not just a food, but for nourishing and immunoprotection. So here are the key messages to remember from the webinar. Pregnancy is not a contraindication to getting a COVID-19 vaccine. Second, infant nutrition should be considered a public health issue, not a lifestyle choice. And third, breastfeeding is the safest, cleanest source of nutrition especially during the pandemics. Maraming salamat po sa inyong lahat, and back to you, Susie and Enrica.
Thank you so much. That's our Chancellor. Padilya, ang galing talaga nung mag-summarize, no? And I myself, I'm going to watch the playback of this. Okay, so let's proceed with teka, ba't nawawala ako?
Yung sneak peek natin next week, exciting, Doc Susie.
Oh, pero parang nag-blank yun. Parang nag-blank eh. O sige. Okay, sneak peek for next week. Okay, naku. You have to invite everyone to watch this, not just because we have great speakers, but because I know you want to hear about this. Okay, so our topic next week is monkeypox and COVID-19. And we have two of your favorites, Dr. Jean Solante from San Lazaro Hospital, who you've heard before, napakahusay po. And of course, Dr. Eric Tayag from the Department of Health. So don't miss it. Naku, masaya to sa Friday. At saka sa Friday, Rika, I'll be in the Philippines.
Yeah, so magkikita na tayo sa wakas.
Magkikita na kami sa wakas kasi hindi nyo na maitatanong, biglang gano'n nag-volunteer, no? Meron akong bagong apo. And talagang nagbe-breastfeed ng todo-todo yung anak ko. Nag-uusap nga kami about the breastfeeding almost every other day. It's her second child. But yeah, it's a very real thing. We have to take care of our kids. And anyway, so that's our episode for today. But join us next week. Naku, we're gonna hear about monkeypox. I also want to learn more about monkeypox. Over to you, Rika.
Thank you. Ako nagulat nga ako sa photo kanina nung nag-news update kayo, yung photo ng monkeypox na bigla.
Ang laki, di ba? Ang laki ng mga bulutong. Sabi ko,
ganun pala yung
ganyan pala yan. Nakakatakot. Anyway, sige.
Okay, so before we conclude our program, let us first acknowledge the following. Thank you very much to the University of the Philippines System, UP Manila National Telehealth Center, UP Information Technology Development Center, TVUP, the Internet Television Network of the University of the Philippines, UP Philippine General Hospital, and everyone who has helped to make this learning series possible. Also, we understand that everybody's so busy, so we have some selected presentations that we will feature in its entirety in what we lovingly call the SCD Shorts. So you can watch them at your convenience at the TVUP YouTube channel. And finally, all Stop COVID Deaths webinars from 1 to 101 will be archived for viewing at the TVUP YouTube channel, also for your convenience. So this formally closes our webinar for the week. We look forward to your company again next Friday. It's a date.
Together, we can stop COVID deaths.
Stay safe, stay healthy, and see you online.